Aging is a natural journey, but as we pass the age of 50, our bodies start to communicate in more subtle, urgent ways. What may seem like harmless discomfort can actually be your body waving a red flag, warning you to pay closer attention to your health. Understanding these signs early on can prevent serious complications, help maintain vitality, and improve your quality of life. Let's explore 5 key symptoms that suggest your body needs more care, support, and attention, especially after 50. But before we dive into all that, if you're new here, welcome to the channel. We're here to help you live healthier, feel better, and age vibrantly. Be sure to like this video, subscribe, and turn on the notification bell so you never miss a wellness tip that could change your life. And tell us in the comments, where are you watching from? We love hearing from viewers around the world. Sign number 1, persistent fatigue, more than just feeling tired. Occasional tiredness is a normal part of life, especially after a long day or physical activity. But when fatigue becomes constant, even after adequate rest, it may signal something deeper than just aging. This type of unrelenting fatigue can interfere with your ability to carry out everyday tasks and may point to an underlying medical condition that needs attention. Common causes of ongoing fatigue. Anemia. This occurs when your body lacks enough healthy red blood cells to deliver oxygen efficiently to tissues. Anemia can be caused by iron, vitamin B12, or folate deficiencies, and often leads to exhaustion, dizziness, and pale skin. Thyroid disorders, both hypothyroidism, underactive thyroid, and hyperthyroidism, overactive thyroid, can disrupt energy regulation. Symptoms may include fatigue, weight changes, and mood shifts. Heart conditions. In heart failure, the heart struggles to pump blood effectively, which limits oxygen supply to muscles and organs, leaving you constantly drained. Depression. Emotional health and physical health are deeply connected. Depression in older adults can often manifest as chronic tiredness, lack of motivation, or sleep disturbances. What you can do: prioritize quality sleep. Aim for 7 to 9 hours per night. Create a consistent bedtime routine with calming activities like meditation, gentle stretching, or a warm bath. Eat a nutrient-rich diet. Focus on foods high in iron, B12, and folate. Include leafy greens, legumes, lean proteins, and whole grains. Stay physically active. Regular low-impact exercise like walking, swimming, or yoga can improve circulation and energy levels. Seek medical evaluation. If fatigue lasts longer than 2 weeks despite good habits, consult your healthcare provider. Blood tests can reveal nutritional deficiencies, thyroid imbalances, or cardiac issues. Sign number 2, shortness of breath, a symptom that deserves immediate attention. If everyday activities like climbing stairs, gardening, or walking short distances leave you unusually winded, don't brush it off. Shortness of breath, especially when it's new or worsening, can be a red flag for underlying heart or lung conditions. Your lungs and heart are responsible for supplying oxygen to the rest of the body. If either system is compromised, your body compensates by increasing your breathing rate, making you feel short of breath, even with mild exertion. Common causes of breathlessness after 50. Chronic obstructive pulmonary disease, COPD, often caused by long-term smoking or air pollution exposure. It narrows airways, making breathing difficult. Asthma. Inflammation in the airways can trigger wheezing, coughing, and shortness of breath, especially at night or after activity. Heart disease. Conditions like congestive heart failure or coronary artery disease reduce the heart's ability to circulate oxygen-rich blood efficiently. Pulmonary embolism. A blood clot in the lungs can cause sudden, sharp chest pain and difficulty breathing. This is a medical emergency. What you can do: incorporate aerobic activity. Moderate exercises like brisk walking or cycling can improve lung capacity and strengthen the heart, helping reduce breathlessness over time. Avoid tobacco and pollutants. Quit smoking if you haven't already, and limit exposure to dusty or chemically polluted environments. Maintain a healthy weight. Excess weight puts pressure on both the heart and lungs. Eating a balanced diet and staying active helps reduce the strain. Consult your doctor promptly. Persistent or worsening breathlessness should always be investigated, especially if it's accompanied by chest pain, dizziness, or fatigue. Sign number 3, sudden and unexplained weight loss, when less isn't more. While weight loss is often celebrated as a sign of improved health, Unintentional weight loss, especially in older adults, can be a red flag for underlying disease. If you're shedding pounds without changing your diet or increasing your physical activity, it's essential to take notice. Losing more than 5% of your body weight within 6 to 12 months, without trying, should prompt medical evaluation. Possible underlying causes. Diabetes. In uncontrolled diabetes, the body cannot use glucose for energy effectively and begins breaking down muscle and fat, resulting in weight loss. Warning signs include excessive thirst, frequent urination, fatigue, and blurry vision. Thyroid disorders. Hyperthyroidism, or an overactive thyroid, speeds up your metabolism. This can lead to rapid weight loss, anxiety, heart palpitations, and sweating, even with a normal appetite. Digestive disorders. Conditions like Crohn's disease, celiac disease, and chronic pancreatitis impair nutrient absorption. You may be eating adequately but still losing weight due to malabsorption. Cancer. Some cancers, particularly those affecting the digestive system, like pancreatic, colon, or stomach cancers, can cause significant weight loss even before other symptoms appear. What you can do: track your weight consistently. If you notice unexpected changes, don't wait. Talk to your healthcare provider. Eat nutrient-dense foods. Incorporate healthy fats, avocados, nuts, seeds, lean proteins, and whole grains to support weight and energy. Consult with a specialist. A doctor may recommend blood work, imaging, or referrals to a gastroenterologist or endocrinologist to find the root cause. Sign number 4. Changes in digestion, more than just an upset stomach. As we age, digestive changes become more common, but that doesn't mean they should be ignored. Symptoms like persistent bloating, constipation, acid reflux, or sudden changes in bowel habits may point to larger systemic issues. The digestive system is a mirror of overall health, and any long-term disturbance can be a sign that something else needs attention. What to watch out for? Irritable bowel syndrome. IBS, a chronic condition causing abdominal pain, bloating, gas, and irregular bowel movements. Colorectal cancer. A leading cause of cancer-related deaths in adults over 50. Early signs include blood in the stool, narrow stools, unexplained weight loss, and changes in bathroom habits. GERD, acid reflux gastroesophageal reflux disease, causes persistent heartburn, chest discomfort, or sour taste after meals. Gallstones. Hardened deposits in the gallbladder can block bile flow, causing pain after meals, nausea, or vomiting. What you can do: boost your fiber intake with whole fruits, vegetables, legumes, and whole grains to keep digestion smooth. Stay hydrated to prevent constipation and support overall digestive function. Limit processed and fatty foods, which can exacerbate bloating and reflux. Schedule regular colon screenings, especially if you're over 50 or have a family history of colorectal cancer. Sign number 5, memory lapses or mental fog, when forgetfulness isn't normal. Occasional forgetfulness, like misplacing your keys or forgetting a name, is expected with age. But if memory lapses become frequent, disorienting, or begin affecting daily life, it may be a sign of early cognitive decline. Conditions like mild cognitive impairment, MCI, Alzheimer's disease, and other forms of dementia often start subtly but worsen over time without intervention. What to watch out for? Early dementia warning signs. Forgetting important dates, struggling with familiar tasks, confusion in familiar environments, and language difficulties. Brain fog. A sensation of mental fatigue, reduced concentration, and sluggish thinking. Often associated with poor sleep, chronic stress, hormonal changes, or nutritional deficiencies. Depression. In older adults, depression can mimic dementia by impairing memory, focus, and interest in daily life. What you can do: challenge your mind. Regular brain exercises like puzzles, memory games, reading, or learning a new skill can strengthen neural connections. Stay socially active. Engaging with others boosts mood and keeps cognitive functions sharp. Eat a brain-healthy diet. Include omega-3 rich fish, berries, leafy greens, and foods high in B12, vitamin D, and antioxidants. Seek a professional assessment. If memory concerns persist, get evaluated. Early detection allows for lifestyle changes, medication, or cognitive therapies that can slow progression. Your body is constantly communicating with you, and especially after 50, it's vital to listen. Sudden fatigue, breathlessness, unexplained weight loss, digestive changes, and memory problems are not just part of getting older. They're signals, sometimes urgent ones, that your body needs more attention, rest, or medical care. Remember, early detection saves lives. Healthy habits prevent chronic disease. Informed choices lead to empowered aging. If you found this helpful, give it a thumbs up, subscribe to the channel, and leave a supportive comment to help others learn about these signs. We wish you long life, strong health, and a clear mind. Thank you for watching, and we'll see you in the next video.